We really position ourselves not just as a quality healthcare provider, but as the place to come for everything to help a patient feel safe and connected to all the resources that they need. So even though a patient would typically come to us for their annual checkup, they can also come to us to tell us, we're really struggling to make our rental payments or we can't get our utility bill paid. And it's going back to that community health center I talked about earlier. We partner with other agencies who can help with immigration paperwork, with tax returns, with utility bill payments or support with housing. And our health advocates, these are staffers that we have, will actually connect the patient to these resources and then follow through with them to make sure that they're actually connecting and getting where they needed to go.
This is Associations Thrive, the podcast celebrating successful associations and their leaders. I'm your host, Joanna Pineda, CEO and Chief Troublemaker at Matrix Group International. Listen in as top association executives tell all, revealing the creative and innovative ways they're increasing membership, generating revenue, nurturing engagement, and reimagining their organizations. By the way, if you've launched a new initiative, created new member services, or updated your governance structure and are seeing great results, I want to hear your story, and so do my listeners. I'd love to have you as a guest. Go to podcast.matrixgroup.net and apply to be on Associations Thrive. Now let's dive into this week's show. Today, I'm speaking with Eloisa Perard, President and CEO of Gracelight Community Health. Eloisa, welcome to the show.
Oh, thanks for having me here.
Eloisa, tell us about Gracelight.
Gracelight is a federally qualified community health center. We're in Los Angeles. We have 5 community health centers, and we serve around 24,000 community members. Our patients are typically underserved, low income, uninsured, or underinsured. And we've been in Los Angeles serving the community for over 125 years. So deep roots.
Eloisa, what does it mean to be a community health center?
Yeah, it means that we serve everybody who comes to us for help, regardless of their ability to pay, their immigration status. They will always get care and help if they come to see us, never turned away.
And so you've got 5 locations in the LA area. Eloisa, what's it like today to be in LA at this time? The fires, I think, have finally been contained, but there's so much devastation, so many people now homeless.
Yeah, thanks for asking. The fires were devastating for our community, and there are a lot of members of the community that are looking for housing and support. Thankfully, the fires have already been contained, but the after effects are going to be long-standing. So what we're seeing now is a lot of incidents of people coming in for help related to pulmonary, right? We have air quality issues after the fires.
Oh.
But the biggest burden, of course, is trying to find shelter, housing, and the rebuilding process. We are working with other community partners to be a solution. We started a fire relief fund. We had some patients that lost their homes and some staff members that had to live at hotels for quite a while, some still living in hotels. But we're doing the best we can to provide resources and support along with so many other incredible community organizations in LA.
Eloisa, your 5 centers were unharmed?
Thankfully, yes. Our 5 centers were unharmed. We remained open throughout the pandemic.
Wow.
We also have mobile support. So we had our mobile program out in the community distributing water and really just trying to see where we could meet the need. It was water, it was food, it was masks, clothing, right? Just trying to mobilize resources for those who were impacted.
When you have a situation like that, where there's really widespread fire, for example, what are the biggest needs that your health centers are meeting?
Yeah, that's a great question. I think that the biggest need we're meeting is connecting people to the resources. They trust us. We've been serving the community for over 100 years. And so Gracelight has been known as the place to come, not just for your healthcare, but to get help for all your needs. After having a tremendous loss, like a fire devastation, losing a home, or God forbid, a loved one, you're sometimes in a daze. You don't even know what to do next, what to do first, right? So we have community health workers and we have our providers, of course, who will provide the resources and support. Sometimes all you need is to know what is the next step. So we help through education, through creating lists of community programs and supports, helping to connect people to temporary housing, helping to connect them to food supplies, clothing, right, and to rebuild.
Oh my God. So you're doing more than like doing a checkup.
Yes, we're doing much more. And that's because community health centers, it's not just about who we serve, right? The underserved. It's about the fact that we really link arms with other community supporting organizations. So we have a partnership with the food bank. We have a partnership with shelters. We have partnerships with agencies who can help pay utility bills for clients, right? Help with Medi-Cal applications. And together we move like one, right? We refer back and forth. We ensure that patients connect with the resources and we follow up with them. It's about creating a safety net around the patient.
Well, that is just amazing. And we have a lot to talk about when we dive into all the things that Gracelight is doing. But before we do that, we got to talk about your journey. How did you get to become president and CEO of Gracelight? You got a big job.
Yeah. I was first introduced to public health as a young single mother. I grew up in a community where accessing healthcare was difficult. We relied on public health in my family, Medi-Cal, and local community clinics. And so as a teen mom, I juggled my job, my child, right, my schooling. I went to school while I was working full-time and while I was parenting full-time. The guidance that I received from the providers and the professionals at the community health centers that I went to, it really fueled my desire to get into public health at some point, right? To be part of the solution. But I didn't start out in healthcare. I actually worked as a human resources professional for 20 years before I jumped into healthcare.
Wow. Okay.
Yeah, I came into my current position as the vice president of human resources. And I just fell in love with the mission. I remember in the early days that I was here, I was walking through the clinics and I saw this young teenage girl with a little boy on her hip standing at the desk. And I can tell she was very distressed. And the community health worker that she was talking to was giving her resources and trying to help her. And just right there, I remembered how that felt and that I wanted to be part of giving back to the community.
Eloisa, it's one thing to be working in HR, but another thing to be CEO. What's that journey like? What kind of training and how different is that?
Yeah. I had an incredible mentor when I came into the organization, and she really took it on to teach me what I needed to know. I think she saw the light in me, how much I related to the services we were offering and how my personal journey had been in community health when I was younger. When you feel passionate about something, it becomes bigger than your job. It becomes your mission, not just the organization's mission, but your personal mission. It was not easy to be a single young mother. My parents were immigrants also. My first language was Spanish. They were blue-collar parents who were just trying to keep us housed and trying to keep us well. I feel so blessed that I could go to school, that I could make them proud.
Yeah.
And I knew that I wanted to be at Gracelight when I started my role in HR. And I learned everything I needed to learn. I got involved as much as I could. I spent a lot of time in the clinics understanding the patients and their needs. And again, it was just like seeing my family every time I went into the health centers. Those were my parents sitting in the waiting room. That was me with my baby standing at the help desk.
Eloisa, I'm hearing from many of my clients that run nonprofits that this is a challenging time. How do you make sure that you take care of yourself as well? Because it's easy to kind of lose yourself because you see that the need is so great and you see yourself in your patients. How do you make sure that you stay well so that you can continue to help these patients?
Yeah, it's challenging. I'm not even going to sugarcoat it.
Hmm.
The last 3 years, especially, I'm part of a generation that is the sandwich generation, not only taking care of my son, who is now an adult, thankfully, but my parents who were elderly. I just lost my dad last month, and it was such a difficult thing.
Oh, I'm so sorry.
But if anything, I had the gift of being able to take care of him for the last 3 years and see his last days. And I was reminded about not only the gifts that my dad and my parents gave me as a young woman that allow me to be where I am today, but of how important it was, the resources I received. So, how do I take care of myself? Well, I exercise quite a bit. I never forget that. Meditation, the traditional things, journaling. I will add, though, that being in this role, it really can't be because you want to have a job and you just kind of want to do the start and the finish. Like you have to be so invested and your heart has to be so into it because the challenges that come from leading an organization like this are not small. We're constantly faced with shortages of funding, with provider resources. We don't have enough doctors to meet the need. There's never enough staff to meet the need.
Wow. Well, let's turn to Gracelight because it sounds like the need is great, but you are up to the challenge. What are some of the biggest challenges in LA right now?
Yeah, Los Angeles, like everywhere else in the country, has its challenges. I'd say that the biggest challenges we're facing are around our unhoused population. Substance use disorders are soaring, and we're just trying to figure out how to meet the demand and help bring resources to the community members where they need them and where they are. So often we can't find the patient because they move around a lot, right? And how do we connect with them so that we can deliver meaningful care?
You talk about providing comprehensive care. So what does that mean? One-stop shop care. What does that mean?
Our health centers are intentionally set up so that we have as many services as possible contained in one building or one location. So we have primary care, pediatrics, dentistry, optometry. We have an OBGYN. We have our pharmacy, all contained in one building to make it so that there are no barriers to care for our patients. They can come in and go see the dentist upstairs, the optometrist downstairs. So much of our population are working jobs where they have to take time off. And when they do, they're not making money for those hours, right? And we want to make sure that their visits are as impactful as possible so they can get back to the role of living their lives, feeding their families.
Now, coordinating this care has to be a big task. Do you have case managers as well? Someone coordinating this? I mean, this sounds amazing, and your patients are really lucky, but it sounds like a really big deal.
It is a big deal. We do have care coordinators, and I'll tell you, it never becomes more obvious how much of a need it is. Even though I'm the CEO of a health center, Joanna, like I said, I was taking care of my dad, and in those final years, I didn't realize how challenging it was for him to manage his own care.
Oh, yeah.
What I learned was the role of the care coordinator is so important because it helps to keep the patient on track with all of their appointments and making sure that the doctors are talking to each other and creating a care plan that is holistic and takes into account all parts of that person.
Well, I need a care coordinator because sometimes I feel like, oh my God, like, please talk to each other. Do I really need that x-ray and I have to go across town for that and then come back and they're not talking to each other?
Oh, yeah. And what would happen is he'd go to one doctor, they'd order lab tests. He'd go to another doctor, they'd order the same lab tests. He'd go to another doctor, same lab tests.
Right.
And so, sometimes in our intent to be good to them, we're not paying attention and ordering the same lab tests for all of the doctors, right? So a care coordinator helps to reduce the duplication of services. Not only does it help the patient, they're not having to suffer the pain of the needle stick over and over, it helps to reduce the expense.
Absolutely, right. It sounds like you're also coordinating care that's not healthcare related, like help with utility bills or housing. How does that work?
Yeah, so we really position ourselves not just as a quality healthcare provider, but as the place to come for everything to help a patient feel safe and connected to all the resources that they need. So even though a patient would typically come to us for their annual checkup, they can also come to us to tell us, we're really struggling to make our rental payments or we can't get our utility bill paid. And it's going back to that community health center I talked about earlier. We partner with other agencies who can help with immigration paperwork, with tax returns, with utility bill payments or support, with housing. And our health advocates, these are staffers that we have, will actually connect a patient to these resources and then follow through with them to make sure that they're actually connecting and getting where they needed to go.
Eloisa, this sounds like wonderful service for your patients. How are you funded?
The funding is always challenging. We receive federal funds. We also receive funds through the state Medi-Cal program. We do a lot of fundraising and development. We're about to do an expansion into a new health center. We're building a new health center in East Hollywood, so a capital campaign. We have a lot of community support. Thankfully, we've been in the community for so long that we are a name that people recognize and support. And, despite that, it's always a challenge. We're always thinking about the next program or the next funding stream. To date, we've been very successful in serving our community. And I have to say, I'm incredibly proud to stand at the head of an organization that's been around 100 years. And I always tell my staff, I hope that 100 years from now, because of the work we did, someone else can be standing here and saying that they've been at the head for 200, right? Like,
wow.
We just want to push this mission forward the way that our predecessors did.
Well, it sounds like you're creating very meaningful connections with the community and that your fundraising is doing really well if you're opening up a new community center. So what are some tips that you would share with a nonprofit that's fundraising in a challenging climate like now?
I'd say that the relationships with your community partners are everything. With your local representatives are so important. The need is there and the resources are there. You just have to really be intentional about building relationships and highlighting the work you're doing. So we have so many incredible success stories from patients who first decide they're afraid to come see us because they're afraid of the ramifications to their immigration process, right? We're out in the community helping them to see that it's a safe place. They can come to us. So be visible with your services, build meaningful relationships with your community partners, be relentless in your pursuit. It really has to be something you're so passionate about that people can see the passion, the outcome, the work, and the impact.
Well, speaking of outreach to the community, how do you let the community know what you do and that it's a safe place so that a young Eloisa knows to come in?
Yeah, so there's a lot of things we do to try to integrate with the community. We go and talk to, like just yesterday, I was having coffee with the principal of a school that is near one of our health centers. And coffee with the principal actually involves bringing all the parents in to talk about the services we offer, how we can better support them, right? We have community health workers or promotoras that go out. These are like comadres. These are people that live in your neighborhood that understand the importance of healthcare. And they go to community meetings. It might be city meetings. It might be meetings with the schools, right? To talk about the importance of healthcare and how you must show up and be an active participant in your own care.
Boy, that's amazing. Well, speaking of being an active participant, during the prep, you and I talked about how often the care that you're providing is a reaction to something chronic or something really urgent. How do you educate your communities about the importance of preventive care and healthy living, healthy practices? Because that's ultimately probably going to solve some of these issues.
Yeah, that's a really great question. You're correct that a lot of times people start thinking about coming to healthcare because they've already have pain. They already are feeling a way that they've determined is not a good way. And so medicine today is very reactive. And I'm not just speaking for our community, I'm speaking at large.
In general, right?
Yeah, it's very reactive. We go once the pain exists. And one of the things that really was so exciting to me when I came into healthcare was the prospect of being part of the change, part of turning medicine into something that is more living healthy and stopping disease from coming on rather than treating disease after it's already started. We do a lot of the typical things. We do education campaigns. We do mobile food demonstrations, right, to teach people how to cook more healthy. And I also recognize that some of it is just a part of our cultural or social norms. La tortilla is so important to my family, and you can't change people overnight. And so what we try to do is we try to take an approach that really talks about keeping the culture alive while healthifying it a little bit. Food is medicine.
Yes.
Yeah.
Wow, Eloisa, this has been an amazing interview. For people that want to support your work, how can they get more information?
They can go to our website at gracelight.org. They can also follow me or Gracelight on LinkedIn. I'm on LinkedIn as Eloisa Perard, or we have a LinkedIn page, gracelight.org. We are in the community, always available to support anybody who needs resources or partnership. And so I do invite people to just take a look at what we're doing on our website.
We will put links in the show notes to all of these things. And for my listeners, if you'd like to support the amazing work of Gracelight, especially given what's happening in LA, thank you for your generosity. Eloisa, thank you so much for being here today.
Thank you very much, Joanna. It's been a wonderful time.
Thanks for listening to Associations Thrive. We're so glad to have you here. You know, my personal mission and the mission of my company, Matrix Group International, is to help associations and nonprofits increase membership, generate revenue, and thrive in the digital space. I want to hear stories of how your organization is thriving in today's challenging landscape. Please apply to be on my show by going to podcast.matrixgroup.net. By the way, do you need help with a digital initiative? Maybe it's a website redesign, a new membership database, or a hybrid meeting that you're planning. I'd love to connect with you. Please visit the Matrix Group website at matrixgroup.net. Thanks again for listening to this week's episode of Associations Thrive. Don't forget to subscribe to the show, leave a 5-star rating, post a comment, and share it with your colleagues and friends. Bye!